Dr. Becker-Schutte, thank you so much for joining us today. I wanted to ask you about one of your areas of expertise, which would be patients in online communities who are coping with mental health issues. Can you speak a little bit about the importance of that?
Yes, I have been fortunate enough to work with several different online communities over the past 4 years or so, and it has turned out to be a really fantastic forum for people to start to feel connected and heard around mental health issues. So often the mental health piece of a person's health journey is experienced kind of in silence and in private, which makes it even harder to bear. You know, if you're struggling through anxiety and depression around upcoming treatments or recurrence of an illness, to not be able to talk about feeling anxious and depressed really increases the burden on the folks who are dealing with those illnesses. And so once the online community started putting the questions out there and saying, so who here has dealt with this? And you can almost see this virtual raising of hands. I have. And then there's almost a sigh of, oh, this isn't just me being broken. This is a real thing that people with my condition deal with. And it's incredibly powerful.
So do you think it adds to the stigma having these communities be online and anonymous, or does it detract from the stigma?
You know, not all of the communities are anonymous. There's a lot of choice there about how much you reveal in those online communities. And the problem with trying to decide does it increase or decrease is that there is stigma. People have lost their jobs or their health insurance coverage when they acknowledge mental health concerns. And so I don't fault anyone for choosing to remain anonymous, because as much as I would like for the stigma to be gone, it's still very real. This is something that people deal with all the time. And if the anonymous space in a health forum allows them to get the support they need without putting a professional situation at risk, as long as they're getting what they need, that at the end of the day is the most important thing to me.
Thank you so much for speaking with me
You're
today.
welcome.